Hi, I'm Dr. Natalie Bello, and it's my pleasure today to be joined by Dr. Emily Lau from the Mass General Brigham Hospital. And we just finished a really exciting panel about pregnancy, hypertension, and postpartum care after pregnancy for individuals with high blood pressure.
Well, thank you so much for having me. I'm really excited to be here to be part of a session really focusing on pregnancy all the way through the postpartum period.
But yeah, we had a really wonderful discussion, and I think, Emily, you brought up some great points about all the patients you see in clinic. Maybe for the folks who weren't able to join us, could you tell us a little bit about what do patients ask you after they've had a pregnancy complicated by hypertension? How are you helping care for them?
Great. I think that's exactly the focus of this talk, is really to take you through a patient's journey from after their delivery, because in fact, their blood pressure journey doesn't stop at delivery. We know actually that peak blood pressure occurs in the early postpartum period, which is actually the period of highest maternal risk. So monitoring and treating blood pressure during that time is really important. And also there are a number of questions about what types of blood pressure medications, particularly among women who are breastfeeding. Those come up all the time. And then also, what is the optimal way to be monitoring blood pressure? So those are just a few of the points that we talk about.
You know, it's always struck me that we often send home patients just before this most vulnerable time period. Can you talk to us a little bit about what you're recommending for individuals who might be at high risk for blood pressure after they've been discharged?
Yeah, that's such an important point, Natalie. We actually see that peak blood pressure doesn't actually occur until about 6 to 7 days postpartum. And so if we're not monitoring blood pressure during that period of time, we're actually missing a really vulnerable time in a woman's postpartum journey. So what I recommend for all women with hypertension during pregnancy is to be monitoring their blood pressures about 1 to 2 times a day in that very early postpartum period, up to about 2 weeks postpartum. And then usually that should be paired with some sort of blood pressure check, whether that's in the office or through some remote blood pressure monitoring program, because that is also a time where we need to be titrating medications.
So true. And I think we have a lot of really great companion materials online that complement the new 2025 high blood pressure guidelines. We've got a great chart that sort of helps us both as clinicians, but also for our patients to know what is a good blood pressure during pregnancy and also in the postpartum period. What things should we be worried about? What do you tell your patients as far as warning signs, red flags that they should let you know immediately rather than, say, checking in with the nurse or the telehealth service?
Yeah, so those, I think the new algorithms and the new approaches and materials are so critically important because it actually allows patients and providers to really follow a proven approach to think about blood pressure. But in terms of what symptoms patients should be looking out for that really elevates their risk, so certainly symptoms like headache, shortness of breath, right upper quadrant pain, abdominal pain, those are times when we're saying, okay, you need to go check in with your doc, and we really probably need to bring you in for an urgent assessment.
Yeah, I think the other thing I've learned a lot from our neurology colleagues is that headaches aren't necessarily normal after delivering a baby. And so visual changes, headaches are another thing I try to educate. And it can be tricky to tease out, is this a post-spinal headache or is this really something? So I think having that knowledge about blood pressure and symptoms is just so important for our moms so that we can keep them and their babies healthy.
Absolutely.
As we think about the continuum after delivery and through the interpartum period when our patients are thinking about getting pregnant again, do you counsel your patients about low-dose aspirin and how that might be useful for them for future pregnancies?
Yeah, this is a great point, and actually not something we had addressed in my specific talk, but low-dose aspirin prophylaxis for prevention of preeclampsia is critically important for patients who've had a history of hypertensive disorders of pregnancy or if they have a number of risk factors. And actually, in studies within our own site, but also other studies have shown that aspirin prophylaxis is wildly underutilized. So I think this is a really effective, low-cost intervention that has real impact on maternal outcomes and neonatal outcomes that we really need to be highlighting for our patients.
Great. Thanks. Any last thoughts for our audience or other takeaway points from your talk?
I would just say that, so often we think about the pregnancy period. Our attention, of course, is on the health of mom and baby up until delivery. But some of the most vulnerable times in a mom's blood pressure journey and health journey is really in that early postpartum period. So really being vigilant, making sure that we're monitoring blood pressure, and having an opportunity to be able to engage with care providers is really important.
Great. Thank you so much. This has really been a pleasure, and it was a great session. Hopefully our audience will watch for some more tips and tricks and get lots of great information from both Dr. Lau and all of the wonderful speakers who gave talks, and then our panel discussion that followed.
Thanks so much.
Thank you.